Okay, so we have begun the recording. So, hello everyone. I'm Dr. Rushali Rani Khan, your dermatologist, and I'm beginning this series now where I am going to be talking with doctors from different specialities, which will be connected by skin. Okay, so today I am stressing on this topic of stress and skin, and who better to invite than my very dear friend and a very eminent psychiatrist, Dr. Nahid Dave. Hi, Dr. Nahid.
Hi, Vishali. Thanks for having me. It's a real pleasure to be here. Vishali, who is my dermatologist and also a very dear friend. And after that introduction, I really have to live up to it now. Eminent.
You definitely will. I'm sure about it. So, Dr. Nahid, could you, when I say stress and skin, what comes to your mind? Would you like to start this topic?
See, there are very often we tend to think that stress is related to the mind only. And stress and depression, and these words are used very loosely in our community. So, if I'm upset over something for a few hours or days, I would want to call it depression or anxiety. Very, very easily, I tend to use that word. But it's much deeper than that. So, stress not only presents in the form of anxiety, depression, but there are a lot of somatic symptoms. There are a lot of symptoms which come because your immunity reduces, or you get more prone to infections or skin diseases as such. So basically, whenever you're stressed, there is a hormone in the body called cortisol, which is released, and because of that, there are a lot of changes which are seen. So from increased craving for sugary items to decrease in immunity to inflammation in the skin and a lot of diseases like psoriasis and acne and all of that. I think it would
Right.
be better to explain that, but it's all interrelated. One common myth people have is, they say this very often: I was depressed, but I distracted myself. I was stressed and I got into movies or I got out with my friends and felt better. If you can distract yourself with these things, you're not depressed. You're
Right.
just upset. When nothing works, then it's depression and stress. Yeah.
Right.
So, I think you can elaborate better on stress related
Yeah.
disorders.
So I am going to talk about a case of one of my patients to you, and I think you could help me more in understanding it better and also our audience as well. So I had this one
Okay.
patient of mine. So she was an old patient. She was a high profile actor. Okay. And
Mm-hmm.
she called me one day and she said, I have my 16-year-old and she's having
Mm-hmm.
this condition called as alopecia areata. And I want to see you and set up an
Okay.
appointment to take these injections for the same. For those who don't know what is
Mm-hmm.
alopecia areata, it is basically an autoimmune condition where you start losing
Mm-hmm.
hair as round circular patches in the scalp. In men, you can also develop it in the beard area and the eyebrows as well. Okay.
Okay.
So I was like, okay, so she already has a diagnosis. Maybe she was seen by some general doctor earlier, who made her a
Mm-hmm.
diagnosis. So I said, okay, come down. We set up an appointment and I met her. And then I saw
Mm-hmm.
this girl, and then she had this single patch. Okay. A single patch, but and I examined her and everything. I realized that all throughout, it was the mother who was constantly telling me about the symptoms and how that she's so embarrassed about it. And, it's a bald patch in a teenager and everything. And this girl seemed very distant, right? She was a little
Mm-hmm.
shy, she was uninterested, she was a little distant. And then I
Mm-hmm.
said that, okay, you leave the room. I spoke to both the parent and the child separately. And I asked the
Mm-hmm.
child that did she have this habit of, pulling out the hair from her scalp. And
Yeah.
it was
Yeah.
also because, I saw the hair that was there around the patch. They were of different lengths. It was not completely bald. They were small hair, but they were of different lengths, as if they've been purposefully broken. So she said, yeah,
Okay.
once in a while I do it. So I'm like, do you do it when you are stressed? She said, yes, I do it when I'm stressed. And I'm like, how do you feel once you break the hair? And she's like, I feel pretty relaxed. And then I
Yeah.
spoke to the mother, and then she told me that, this child, she had been recently divorced. The mother had been recently divorced, and the child was made to live with her grandparents for a particular period of time.
Yeah.
And then she had to come back because suddenly, then she had to leave the grandparents. All this was a pretty stressful time for her. And that was the
Yeah.
time when I told her that, your child doesn't have alopecia areata per se. She has a condition which is called trichotillomania. Dr. Nahid,
Right.
I want you to elaborate more on this condition.
Yeah, so I think one thing that you mentioned very distinctly was that the mother found it embarrassing that her teenage daughter had a bald patch and the girl seemed very distant. So
Yes,
here is a very important symptom. Like a teenager is very aware of their body image, their self-esteem. It all relies on their physical appearance. And a person who is so indifferent to this physical feature is a symptom. One.
right.
Secondly, trichotillomania specifically is seen. A lot of patients actually go undiagnosed for a very long period of time, going from dermatologist from one to the other without being able to come to the diagnosis because stress is often overlooked. And even if it is diagnosed, it's very difficult to tell a mother or a parent that your child could probably have stress related issues. So
Right.
basically, what happens in trichotillomania is it could be related to separation trauma, it could be related to abandonment, it could be related to a psychiatric disorder like depression or even OCD, obsessive compulsive disorder, where it is typically seen that children feel this excessive amount of anxiety or stress, and on pulling it and the physical pain that they get while pulling it, this relieves the stress. So as soon as you pull out your hair, you get a sense of relief, and then it begins again and you keep pulling. So it's not just limited to scalp hair, even eyebrows, or for boys even the beard hair and the hair in the armpit, and even pubic or the area at your private parts. Some patients tend to pull out that hair because it's not easily visible, so you can easily relieve your anxiety and not have people notice or ask you questions about it.
Oh,
So that's what usually
I
happens.
didn't know that this was also a thing. We always knew about the scalp hair. I didn't knew about the private parts thing.
Right. Yes, that also does happen, and most of the kids are very defensive about it, and we tend to focus more on the hair loss than the stress, which is the primary cause for it to happen.
Yes, yes.
And yeah, it is very difficult. How did the mother react when you told her that she was having?
Yeah, coming to that response. So when I told her mother that, this is not alopecia areata and this is something related to stress. So the first reaction from the mother was, oh, so you think my daughter is mad enough to pull out her own hair? you know so you think like I have caused so much stress in her life to pull out her own hair? So at that point of time I felt that it was not it more than the child per se, it was the mother who also needed a lot of counseling at this point of time. I had to
Mm.
spend some time, but although it's not my specialty, but I had to spend some time to
Yeah.
tell her that there's no point in treating her for alopecia areata when she doesn't have the symptoms of alopecia areata. She's like, what about those injections? I said, no, she's not a candidate for the same. So how
Yeah.
do you go about this particularly? About
So
the
it's
parents,
very
how do they
difficult.
deal with
Yeah.
this,
So
and how
as
do
an
you treat
adult,
such parents?
yeah, so as an adult, people still accept that, I could be having a psychological issue. But if I tell a parent that their child is having some problem related to mental health, the first reaction is very defensive and absolute denial that this is just not possible, and I will not accept it because there is a lot of stigma. And socially, we associate psychiatry, psychology to madness. Somewhere or the other, through social media and all of that, it is being linked together. And the first thing that comes to your mind is that, the person is crazy or what. And
Right.
so people defer treatment for a very long period of time. There are a lot of myths which circulate that, the psychiatrist just put you on medicines and then you remain addicted for life, and you're going to be sleeping throughout and your brain will get dimmer and your liver and kidney will start failing, all kinds of myths. Probably many years back, these things were true. But right now, the medicines and the treatment available is very rehabilitative. So it gets you back on your feet. It gets you working, studying, and coming back to your routine as fast as possible.
Right.
Unfortunately, people don't know that. Young kids, as young as 5 years, 6 years, 8 years, who have trouble with academics, focus, concentration, bedwetting, even they can be helped because they suffer a lot with secondary trauma if it's not treated on time.
Right.
So someone who's having bedwetting goes through a lot of bullying and teasing, which could affect their self-esteem in the long run.
Right.
So one or the other, the correct treatment or the correct time plays a very important role. This reminds me of another condition, dermatitis artefacta, or commonly called a skin
Right.
picking disorder.
Yes,
Yeah,
yes,
so so I've had these patients who come from dermatology to psychiatry, and the kind of lesions are always different. So whenever they go through a stressful period, or they have so much emotional pain, that it's easier to just pick on your skin or hurt yourself in some way.
yes,
So it
yes,
usually happens in a right-handed person more towards the left hand, because it's easily accessible, and the accessible one. I'm sure you must have seen
yes,
patients of
yes,
dermatitis.
yes. So generally what we see is, these patients are troubled in some way or the other. You can
Yeah.
kind of make out through the body language. And these patients are recurrent patients. They always keep coming, their parents or somebody. It's like a cry for attention, I would say. That they would come
Mhm.
with different lesions every time. So one day it'll be one kind of
Mm.
lesions, the other time they come it'll be a different kind of lesions. And they're generally on the reachable parts of the body. So if I'm a right-handed, like you rightly said, it'll be more on the left side. It'll be more on the areas which are easier to reach, so you'll hardly see any lesions on the back ever. And then
Yeah.
whenever I feel that there is some psychiatric component to it, I generally refer it to a friend or someone from my specialty, from this specialty. And I
Yeah.
feel that most of the times, more than the actual skin treatment, like we can only treat it with probably an antibiotic ointment, or a cream to get
Mm.
rid of the marks. But then apart from
Yeah.
that, the major treatment lies with the psychiatrist. So doctor, I
Yeah.
wanted to ask you, in trichotillomania, what kind of treatment is it always by pills, or how is it, how does it generally go, the treatments of both these
There
conditions for the
are Yeah, there are a lot of factors actually. It depends on the age of the patient. It depends
right,
on the IQ of the patient. It
right,
also depends on how long it has lasted.
right,
Okay, and the primary reason why it has occurred is the stress removable. Is there adequate support system? Is it possible to get through to counseling? Also, there are some patients, the hair that they pull out, some chew on it, some throw it, and some swallow it. So
yes,
if some patients who
yes,
swallow it, they tend to have intestinal obstructions and other issues.
yes,
So if it is reached that state, there is also medical intervention which is required. So it
right,
depends on these things. Per se, we treat it like an obsessive compulsive disorder, an obsession and a compulsion to pull, and it is treated in that way. Obviously, we would want on a first line basis for counseling and supportive therapy and habit reversal to work, but at times medications also have to be given, and when it has to be given, it has to be given. It's not
right,
a choice.
yes,
Should I choose counseling or medications when it's required? It's like, if I can't see, I have to wear glasses. I can't eat carrots.
yes, yes,
It's
correct.
like that.
And these medicines, I'm sure, are not habit forming, that you have to take them forever. If you stop the medicines, you go back to square one. It's nothing like that.
No, usually once the patient is on medicines, we believe they get like 70-80% better. And after that, we begin with counseling sessions. They're more receptive and more able to engage with counseling and therapy. And then it's possible to taper off the medicines.
Right, right. That was quite some
Yeah.
learning, Dr. Nahid, today with you. And
Yes. Thank you.
yeah, and yeah, it helped me a lot to talk to patients next time more efficiently when I see
Mhm.
them with the similar conditions. And thank you very much for connecting to us on the Zoom platform today. And hopefully we'll
Thank
meet.
you very much, Peter.
Yeah, and hopefully we'll meet soon enough on another session. And we'll request our audience, if they want us to talk about something specific, then yeah, we would choose that topic and we would go ahead with it. So thank you very much, Dr. Nahir. And
Thank you. And yeah, it was always a pleasure.
yes, chalo. And I'll see you soon. Thank you very
Yeah.
much.
Bye.
Bye bye.
Bye.